everyone, welcome to Occupational Therapy 226 and OT and Pediatrics. Today what we're going to do is look at the movement competency that's coming up, and we'll go through it in class, but this video is a study tool for you basically so that you can see how to facilitate a child going from prone to standing. This is my friend Katie. She's my friend, neighbor, and also an occupational therapist here on Kauai at Wilcox Hospital. So she's going to be my model for today. So first we're going to, we'll do four things. First, you're just going to watch me go from prone to standing and then watch Katie. You're going to practice it a little bit. Then I will show you how I facilitate it as if Katie was my client, so I won't be talking you through it. And finally, the last part will be talking you through the process. All right, so I'm going to go from prone to standing first. Then Katie will, and I'll talk it, and then we'll work on facilitation. All right, so I start off on my stomach, right? First thing I have to do is move to prone unpropped, go into side sit, quadruped, kneel, tall kneel, half kneel, stand. So that's it, all those steps. All right, your turn, Katie. So she's going to go from prone to propped on elbows. And, you can stop the video and do this yourself, right? So I want you to feel what it feels like, this normal progression of movement of going prone to propped on elbows. Next up is side sit with weight on the hand. That's, go ahead and sit up and straighten your elbow. Perfect. Okay. Then to quadruped, into a kneel, tall kneel, half kneel, and stand. All right, so the reason that I had both of us do it is that we have different bodies and every body is different. So I wanted you to see how she does it, how I do it, and I want you to stop the video and see how you do it. So start off on your tummy with your arms by your sides, and then just stand up, see how you move through, right? So when Katie did it the first time, she did no side sit whatsoever. She went from propped on elbows to quadruped, and then boom, she was up, right? See how you do it just normally without thinking about it, and then think through the steps. All right, now we're going to facilitate it. So if you will go prone again. So these techniques are from NDT. If you'll recall, NDT was developed by the Bobaths, and Berta Bobath was a dancer and therapist and a whole bunch of other cool things. And they talked a lot about how to facilitate normal movement. So we'll be talking about NDT and NDT principles, but basically what we're doing is facilitating normal movement. So we're going to think of concepts like weight shifts, center of gravity, center of mass, how we move around our center, things like that. So next I will help Katie to stand, and I'll just talk as if she was my client, then I'll deconstruct it and talk you through. Okay, Katie, we're going to stand up. So the first thing we're going to do is get you up on your elbows. So go ahead and bring your arms underneath you. Great. And now I'm going to help you to sit up on your hip and go ahead and straighten your elbow. Excellent. Okay. And let's get you up on all fours like a little puppy dog. Okay, good. All right, and now I'm going to have you sit back on your heels, Just going to go backwards and come on up. Good. And now let's get this foot on the ground, okay? There we go. Nice. All right. And bring this foot forward to meet the other one. Perfect. Okay, so that's it. Let's do it again, and I'll talk you through it. So, first thing is getting from prone to propped on elbows. And so where I'm going to facilitate is under her clavicles. It's a symmetrical lift, and she's going to help. Now, what happens if her elbows are really splayed out or one is out farther than the other? Then instead of a symmetrical lift, we're going to now do asymmetrical weight shift so that she can bring her elbows underneath her shoulders, and that's the position that we want. Okay? From here, we go to a side sit, and I want you to watch what she does, but also watch what I did. I don't think I did it quite right in the demo, but I need to facilitate. Let's say it's her left side that's affected, okay? I need to facilitate, but I also need to get my body out of the way as she's sitting up. So I'm going to be here. I'm going to use my handling techniques by putting my left hand on her left deltoid, so on the glenohumeral joint. Right hand is going to go on the ASIS, the anterior superior iliac spine. And what I'm going to do is help lift with the left hand, push down with the right hand, and pivot myself out of the way so that she doesn't wind up on my lap. Okay, so it looks like this. And up. Great. So I'm really pushing down with my right hand and scooping up with my left, so now she's weight bearing, okay, and that's super important. I took a wide stance sort of apart from her so that she didn't wind up sitting on me. You may need to, as I said, move out of the way. There's quite a bit of pressure involved in this, right? So it's not light. It's actually really pushing down, and that feels good and secure. And you notice she didn't straighten her elbow right away. I needed to give her some more input to have that happen. All throughout this, you're going to want to use soft hands, not dig into the muscle, but rounded to the client's anatomy. All right, from here, I'm going to facilitate at both hips, and we're going to go into quadruped. So I lift and help her situate her right side. Again, weight bearing over the arms and straight down from the shoulders. Knees ultimately are hips distance apart. From here, we're going to go into a kneel, and she's kind of on the border of the same size to smaller than me, and so I could stay on my knees. I could go into stand. What I'm going to do is just take a really deep squat with my back flat. So we're going to sit back and up, and this can be symmetrical, or it can be, you can be offset. From here, we're going to go into a tall kneel. You can handle at both deltoids. With kids, sometimes I also go underneath the scapulas, so up to you. This part of the process is one that students sometimes struggle with when they're new, and that is an asymmetrical weight shift so that we're unweighting her right side of her body so that she can bring her foot forward into a half kneel. Okay, so what I'm going to do is really support her so that my body is very close to hers. I might even go under here so I have a lot more control. We're going to go over She puts her leg forward, and then again, I'm going to bring my weight back to hers and up to stand. And for this last part, my hands are on her scapulas. Again, not gripping, but just nicely rounded. So that's it. Hey everyone, we're just going to give you a little side view of the prone to stand progression. So here Katie is starting off on her tummy. We're going to first bilaterally at the clavicles bring her into prone on elbows. From there, I'm going to support at her glenohumeral joint on her deltoid, and my other hand is on her ASIS. Now, you know, this is a little bit tender, so you're not going to want to dig into the hip, but just gently round. And actually, the heel of my hand is on her, more on her hip and her butt. So in one motion, we're going to sit her up. So now she's weight bearing. Then I'm going to go bilaterally on her ASISs, and we're going to weight shift over into quadruped. And notice she adjusts a little bit. Her hands are underneath her shoulders. She's protecting her knee, which is injured a little bit, so her knees are not 100% underneath her hips. That's okay. They are hips distance apart, which is important so that when she goes into kneel, she has a wide enough base of support. For the interest of this video, I'll try to stay out of the way so that you can see it, but basically I'm going to help her sit back, weight shift back, sit up. Then we're going to go into a tall kneel. I'm going to go underneath her scapulas. And would you be okay weight shifting this way? Okay. And then I'm going to come down. I'm going to enable her to weight shift to bring her foot out. We're going to quickly get her off that knee and into stand. And again, I'm holding her at the base of her scapula, the inferior border. You can also, with kids, a lot of times go at the deltoids because you have a lot of control and a lot of size differential. So, and then last but not least, I'm not going to be like, okay, and now I'm done. I'm going to stay here to make sure that she is actually up and balanced, and we might adjust a little bit to get her to step forward just a little bit. There we go. All right, that's it. And as Katie reminded me, practice, 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 practice. That's how you're going to get this in your body. Try to find friends and relatives, classmates, etc., people of all different shapes and sizes who will help you and not help you. That's super important. All right, thanks.